Your health report says fatty liver. Your ALT is slightly high. Your AST may look normal, and you feel completely fine. So you wonder, is this serious, or can I ignore it? Here is the truth. Fatty liver is common, often silent, but it can still be an early warning sign of metabolic and liver risk. Fatty liver means extra fat has built up inside liver cells. Many people have no pain, no fever, and no obvious symptoms. But silent does not always mean harmless. If fatty liver persists, some people may develop liver inflammation, liver scarring, or fibrosis over time. The key is not to panic, but to understand your risk level. Fatty liver is now one of the most common chronic liver conditions worldwide. Large global studies estimate that about 1 in 3 adults may have fatty liver disease. It is strongly connected with insulin resistance, weight gain, type 2 diabetes, high triglycerides, high blood pressure, and metabolic syndrome. That is why fatty liver on a report should not be viewed as a liver problem only. It can be a whole-body metabolic warning sign. ALT and AST are liver enzymes. When liver cells are stressed or injured, these numbers can rise. ALT is often more closely linked with liver injury, while AST may rise from liver or muscle-related causes. But here is the important point. Normal ALT or AST does not always rule out fatty liver or fibrosis risk. And high ALT or AST does not automatically mean severe liver disease. These numbers must be interpreted with the full report. Ultrasound can detect signs of fat in the liver. Your report may say mild fatty liver, moderate fatty liver, or hepatic steatosis. But ultrasound usually cannot tell the full story. It may show fat, but it does not reliably measure liver scarring. That is why a follow-up checklist is important. The most important question is not only, do I have fat in my liver? The more important question is, do I have fibrosis risk? Fibrosis means scarring in the liver. Advanced fibrosis can increase the risk of cirrhosis, liver failure, and liver cancer. AASLD and AGA guidance both emphasize risk stratification, especially to identify people who may have clinically significant fibrosis. One common first step tool is called FIB4. FIB4 uses 4 pieces of information: age, AST, ALT, and platelet count. It does not diagnose liver scarring by itself, but it helps doctors estimate whether fibrosis risk is low, intermediate, or high. This is where AI can help organize your numbers, but a healthcare professional should interpret the result. If your risk is not clearly low, your doctor may suggest liver elastography, often known as FibroScan. This test can estimate liver stiffness, which helps assess fibrosis risk. Some tools can also estimate liver fat using controlled attenuation parameters. These tests are non-invasive and can help decide whether you need closer follow-up or specialist care. Fatty liver often appears together with other metabolic risks. Look for high triglycerides, low HDL, high blood pressure, high fasting glucose, high A1C, weight gain, belly fat, and type 2 diabetes risk. If several of these are present, fatty liver becomes more important. Your liver report is not just about your liver. It may reflect your overall metabolic health. Not every fatty liver report has the same cause. Doctors may ask about alcohol intake, medications, viral hepatitis, autoimmune liver disease, thyroid problems, and other conditions. This matters because treatment depends on the cause. Do not assume every abnormal liver test is only from weight or diet. A proper medical review is important. If your report says fatty liver, ask your doctor about this checklist. ALT, AST, and GGT, platelet count, triglycerides, and HDL, fasting glucose and A1C, body weight, BMI, and waist size, alcohol and medication review, hepatitis screening if needed, FIB4 calculation, FibroScan or elastography if risk is unclear, and a clear timeline for repeat labs or imaging. AI can help organize your health report into a clearer picture. It can collect ALT, AST, GGT, platelets, triglycerides, A1C, fasting glucose, blood pressure, BMI, waist size, ultrasound findings, and lifestyle notes. It can help find trends and create a doctor question list. But AI cannot diagnose fibrosis, rule out serious liver disease, or decide treatment. The good news is that fatty liver can often improve when the underlying metabolic risk improves. Weight reduction when needed, regular physical activity, fewer sugary drinks, less refined carbohydrates, better sleep, and improved blood sugar and triglyceride control can all support liver health. You do not need a perfect plan. You need a consistent plan and regular follow-up. Let's summarize. Fatty liver is common, but it should not be ignored. ALT and AST help, but they do not tell the whole story. Ultrasound can detect fat, but fibrosis risk needs better assessment. FIB4 and elastography can help with risk stratifications. Metabolic risks like prediabetes, high blood pressure, high triglycerides, and belly fat matter. The goal is not fear. The goal is early action. If this video helped you understand fatty liver, ALT, AST, and follow-up tests, please like this video and subscribe for more evidence-based AI health education. Comment below. What should we explain next? High triglycerides, kidney function, acid reflux, insomnia, or abnormal blood test results? Your comment may become the topic of our next video.